All right. So my first question is, um, why is it that parents can help identify cases better than children?
Yeah, so the health department is, of course, getting ready to send all of the students, or rather, the education department is getting ready for all the students to come back to school, and the health department is trying to figure out ways to identify clusters of cases if they arise in any school. Um, as it is now, and scientists are still trying to figure out exactly how the disease affects children and how it spreads among children. But as it is now, the general consensus is that that children don't show symptoms as much as adults. So what might happen is that children may be in school together, they may be spreading the disease around to one another, but they may not be showing any symptoms. And so the schools are not doing surveillance testing, so they're not just blindly testing asymptomatic students every day. The testing system that they've set up is actually to test people who are feeling sick or are showing symptoms. But that doesn't work very well if a student isn't showing symptoms. So another thing that the health department is going to be trying to do is that they're going to be testing close contacts, children of parents who test positive for COVID-19 outside of the schools. So in other words, if you're a parent and you feel sick and you're showing symptoms, you go to get tested and it comes back positive. As it is now, and has been throughout the summer, the health department might not necessarily test your children. They'll have them quarantine or even isolate maybe, but they may not use a test to check to whether or not they have it. Now, just because kids are going back to school, they're going to be interacting with one another much more often than they might have been during the summer. The health department's going to be testing them as well, even if they're not showing symptoms.
Okay. And so do you know, I'm just trying to put it back on gallery view. Do you know if that's just in Rhode Island, or is that something that's going to be happening nationally, or is it just in the state here?
No, so I'm not sure what every state is doing, and it should be noted that each state has its own testing protocols. The U.S. Centers for Disease Control and Prevention, they put out guidance to states, but the federal government has made it pretty clear that each state should have the authority over its own testing program. So this is something that's coming out of the health department, something that they've designed and decided to move forward. I would note that the governor and the health director, they are in communications with other health directors and governors across the country. So and they're constantly sharing different ideas and best practices. So it very well could be that this is something that came from the West Coast. I just don't know.
And do you know when they're going to start doing that here, or has it already started?
So the students go back to school next week, and so that'll be part of the overall strategy that the health department is taking in terms of trying to keep the disease out of schools. As you know, Courtney, there's a lot of attention and anxiety among parents and family and teachers and administrators about coming back to school, and so there's going to be a lot of attention on this. The health department is health officials are telling me that they're trying to figure out as many different ways as possible to stay in front of any possible outbreaks that might happen in the school. And this is one way that they think they may be able to identify, especially if a bunch of parents from the same school suddenly come down with a sickness and they get tested and they're positive, but none of their children are. That may be an indication to the health officials, okay, let's test the children because it could be that they all have it too. They're just not showing symptoms.
Based on your research, I know you're not a scientist, you're a journalist, but do you know why the virus seems to be more, prevalent, or more, it shows more symptoms in adults? Based on the people that you've spoken with, the health department, do you know anything as to why?
Yeah, it's a great question, and you hit it right on the head. I'm not a scientist, and I'm not sure that the scientists know either quite yet. There's just a tremendous amount of research that's going into it, both in the United States, but all across the globe, trying to figure out exactly why it is that the disease affects different populations differently. We know that just based on what we see in Rhode Island, across the country, and even around the globe, that older people, especially those with underlying conditions, are much more susceptible to deadly outcomes of the disease than younger people. And and also in children, you know, they're seeing some different types of illnesses pop up. There's a inflammatory syndrome that's seen in children that isn't necessarily seen in older adults. So there's just a lot out there that isn't understood quite yet about this disease. And you know, it's worth noting that it's only been around for about a year,